Friday virtual education programme. My name is Claire Jimmerson and I am the Education Coordinator for the Annapolis Valley at the Alzheimer's Society of Nova Scotia. During the COVID crisis, we're not offering our face-to-face programming, and instead we're using the Zoom platform to stay connected with you. Our audience today includes people living with dementia, people caring for someone with dementia, and people who want to learn more. We want to remind you that the session is being recorded. Today's topic is the signs and symptoms of dementia, a topic we are getting lots of questions about. It will help you identify signs and symptoms of dementia and also offer pointers on how to get further information and support. We will have a 20 to 30 minute presentation followed by 20 minutes of Q&A. Just a reminder that your microphones are muted, but you can type your questions in the chat box at the bottom of your screen. And remember to press enter so we get your questions and feedback. It is my pleasure to introduce Cara Guthrude-Murgatroyd, who is Education and Support Services Coordinator. So over to you, Cara.
Thank you, Claire. Hello, everybody, and welcome, as Claire said, to the 5th session of Signs and Symptoms of Dementia. So this week, we're going to be looking at some of the more common signs and symptoms of dementia. And of course, whether it's Alzheimer's disease that your family member is living with, or if it's one of the other types of dementia, there's a number of common signs that they may experience. But it's important to realize, too, that not all individuals will have the same symptoms. They may not necessarily experience them the same way. And so each person with dementia really has their own strengths, they have their own challenges and personalities, different coping styles and supports. So these will all play a role in how they will experience the disease. So today we'll be looking at some of those signs and symptoms. I actually, the PowerPoint presentation today, it was created by using an infographic actually that we have at the Alzheimer's Society, which is accessible to you. If you're interested in getting a copy of that at the end of the presentation, please let us know. I'm just going to briefly show you a quick little picture of that. I think you might be able to see that, but this is what we've based our presentation on today. So let's move through. Okay, so memory loss that affects day-to-day abilities. So it's normal to occasionally forget appointments and colleagues' names sometimes, or a friend's phone number, and then remember them later. And what I often get asked in public education sessions, actually, that's the question that people have a tendency to ask me is, well, how do I know what the difference is between normal age-related forgetfulness and then, of course, you know, the memory loss which is associated with dementia? And so for those of us over the age of 40, we can appreciate that we're going to have some age-related forgetfulness. So perhaps, you know, you go to the grocery store and you bump in. Today it's a little bit different, you're going to be 6 feet apart, but you may go to the grocery store and run into your neighbor and you can't think of their name, and then all of a sudden, you know, you get home, you unpack all of the groceries, and then boom, you realize it was Sue. I can't believe I forgot Sue's name. So sometimes, you know, going to a grocery store these days is a little bit more stressful than it used to be. So you may have been distracted by that. And so that's one of the reasons why you may have forgotten your neighbor's first name. We do know that for people with dementia, the memory loss begins to affect their day-to-day abilities. So it's recalling or retaining information that has recently been learned. And that can be quite frustrating for the person with dementia. And the other thing, of course, is trying to hold on to dates and events, birthdays and anniversaries, all of those sorts of things become increasingly more difficult to hold on to. So people will begin to rely more on memory aids. So it could be, you know, little sticky notes, little yellow sticky notes like the ones I have here for myself, or it could be using an electronic device, for instance. One of the things to note, though, in the picture here in the infographic, you see a woman and she's standing in front of a calendar. Calendars are a great visual aid to remember, to help people to remember appointments, and maybe family functions that are coming up. The one thing also to remember is some people may get caught up in looking at that calendar every day, and they may become anxious because they see there's an appointment coming up. And so every single morning when they wake up, they may be ready and raring to go that morning because they think that the family reunion is this Saturday as opposed to the following week. So you know your family members best, basically, is what I'm saying. So if the calendar is going to be helpful for your family member to keep track, then by all means use that calendar. But if you think that it's going to be a trigger to cause them to become more anxious because they know there's something coming, they know that there's a date that they need to remember, if that's a trigger, then I would suggest you using it for your own purposes to organize, but to maybe not use it for your family member. And again, we use tips and strategies that work best for our family members. Okay, so moving along, looking at the second picture here, difficulty performing familiar tasks. So you see this gentleman, he's sitting there, or he's standing there, and he's in the kitchen and he wants to prepare a meal. So he's got all of his ingredients out. He's got his pan, he's got his eggs, and I'm not quite sure if that's ham to the right of the eggs, but let's pretend it is. And he's got his salt. So he wants to prepare his breakfast. Maybe it's his lunch. Our routines have changed lately with COVID, so maybe this is his lunch. The thing is it's that process, right? There's a lot of sequencing and a lot of steps in preparing a meal. And so what this gentleman has done is he knows that the eggs need to go in the pan and he has to cook them, but he forgot to deshell the eggs, okay? So these are the sorts of things that begin to happen. It's that inability to do the things that we used to do all of the time, that we do on a sort of like automatic, right? It's like autopilot that we go on. And so also, for people who are driving, and it can be quite common for people in early stage to continue to drive safely. They're monitored by their family physicians on a regular basis. But the first indicator may be being unable to remember how to get to that familiar destination. So it could be driving along the highway, for instance, and not realizing that I have to take exit 3 off of the 103. And they continue on the 103. So those are the sorts of things that become difficult for people. Could be organizing a grocery list. That's another task that we tend to do. And people may begin to have difficulty with that. Or maybe it's, a board game that you always enjoyed playing. And then all of a sudden you begin to forget the rules of the game. Okay, so those are some of the sorts of things that you may begin to see happening, either if you're living with dementia or if you're caring for a person with dementia. So the third sign or symptom, problems with language. So we see this woman, she's picked up the cat. She knows it's a pet. So the two words that come to her mind, it's either a dog or a cat. So it's the ability to pull out a word, the right word with the right meaning, which becomes more difficult for people. So forgetting words or substituting words that don't fit the context, okay? And so for people living with dementia, they may have a difficult time in following along with a conversation or even joining a conversation. So they may stop in the middle of a conversation and they may not know how to continue with that conversation. And also what may happen is they may begin to repeat themselves. So when we look at problems with language, we're really also looking at, yes, it's finding the right word, it's comprehension of language, understanding what's being said, but it's also the ability to express that language. And communication is one of those things that is so important, when we're caring for each other. And so it may be, it's something that people with dementia in the earlier stages, they may recognize, and they may begin to pull back from those conversations because they may get embarrassed at the fact that, they used to be, or they may be more sensitive to the fact that I used to carry on these conversations, and now I'm really struggling to be able to have the confidence in myself to continue on. So if that's the case, then really important for us to support our family members with dementia, to give them the time that they need to continue. And maybe it's just to be a little bit more patient, to help them, to give them the time that they need. And one of our clients at the Alzheimer's Society has said that what she does is she really enjoys a sense of humor. So if she takes a deep breath and then thinks of it and thinks of something funny, usually that will come back to her. So yeah, problems with language is one of the signs and one of the symptoms. Disorientation in time and space. So the gentleman here, he's walking. He could be walking through a hallway. It could be in a mall. It could be walking through the north end of Halifax, or maybe somewhere in Pictou County, and he's walking back from the Tim Hortons, and he really doesn't know exactly which way to go. It's that orientation or that understanding of how do I get back to my home, okay? So what might happen is he may get disoriented and he may get lost. So that's one of those things that we begin to worry about as family members, especially if George loves to go for his walk. And we know that daily exercise is key in maintaining our health, our mental health, and our physical health. So we need to strategize if we think that this is going to be, a challenge at some point. Then really important to start coming up with some ideas. So maybe it's going for a walk with George, or maybe it's calling somebody, and maybe it's a neighbor who also likes to walk their dog. And so the two of them go together with the dog. So yeah, really important to strategize around ensuring George continues to be able to exercise, but knowing that he may get disoriented. So what can we do to support him in maintaining that exercise? There is a program that we are involved with at the Alzheimer's Society of Canada. It's the Medical Alert Safely Home bracelet. And so some families will use the Medical Alert Safely Home bracelet. It looks just like a medical alert bracelet. It says memory loss. It's a little bit different than a regular emergency or a medical alert bracelet in the sense that it says memory loss, and it will have George's first name. So if George becomes disoriented or a little bit confused and can't find his way home, and a good Samaritan, a neighbor, finds him, then they can look at the bracelet, call the number, and the staff through Medical Alert Safely Home are able to get the contact information, call the families, and bring George back home again. So some ideas to think about, and there's some GPS technology as well that can be used. So there are a variety of different options there to ensure that George maintains his exercise, but is also safe. So impaired judgment. So we see this lady, she's waiting for Metro Transit, and we see that, she's not wearing warm mittens. She doesn't have her wool mittens. She doesn't have her winter boots or her heavy jacket. She's standing there with a pair of slippers on. It looks like a pair of slippers maybe, and she's really not dressed for the elements. It's snowing outside. So people may have difficulty with their judgment and knowing, oh gosh, it's snowing out, and maybe I should be wearing something warm. So it's not recognizing that a medical problem may need attention, or as she's showing, wearing light clothing on a day, like a really cold day. And the other thing too to be aware of is a person may begin to show poor judgment when dealing with money. Or they may also begin to pay less attention to grooming. So this is one of the, we get frequent calls through the info line around, I'm really thinking that I'm not sure mom's taking her bath as much as she used to. It's because a person may think that they've had a bath, but maybe that bath was 2 days ago or 3 days ago. So there's that sense of impaired judgment, okay? I usually, when I talk to family members, I always ask them to open up their fridge to check to see if there's any items in there, any food items that may have expired, because what might happen is they don't realize, or they don't have the ability to reason to know, okay, the milk has passed its due date, I should probably chuck that. All right, so there's that impaired judgment and change in a person's ability to reason as well. Okay, problems with abstract thinking. So this gentleman is sitting here and you know, it looks like he's trying to maybe do his taxes. And he's really struggling to sort of focus and to concentrate on the task that he has. And so we know it can be difficult to try to figure out abstract thinking. So having difficulty balancing a checkbook, or perhaps it's understanding what the numbers are and how they're used. And so, you know, for us even, when you think about going to the grocery store, for a person with dementia, it may be quite difficult for them once the groceries go through and the cashier asks for payment. You know, if it's a $60 grocery bill, the person with dementia may be struggling with the small calculations and understanding, okay, how much of this money do I have to give to the cashier? And so because of that, you know, once we get anxious, for any of us, we don't perform as well as we would like to. So this can be quite troubling for people with dementia when they go to pay for their bills. And we actually have some little cards. We have cards at the Alzheimer's Society, which might be helpful if you happen to be either a person with dementia, if you're at the cashier, or if you're taking Metro Transit. They're called forget-me-not cards, actually. We have them for companions, and we have them for people who are living with dementia. And what it does is it's a little card, and on the card it says, I have an illness that causes memory loss and confusion. Thank you for understanding. And by presenting this card, you're able to start off on a different grounding, I guess you could say. People are more compassionate, they're more understanding. So if you pass that to the cashier or the bus driver, they look at it and like, oh, okay, I'll give you the time that you need. And there's a shift in the way that the person then interacts with you. So these are companion cards or forget-me-not cards. So we have them at the Alzheimer's Society for family members and also for people with dementia. So if that's something that you're interested in, please leave us a note in the chat and we can send some of those to you. Okay, and just call at the end of the presentation. We'll actually have the 1-800 number, the toll-free number for you to call info line, as well as the local number as well. So when we're thinking about abstract thinking, the other thing that people may begin to have difficulty with is speaking on the telephone. And if you think about talking on the telephone, it can be quite abstract in the sense that you don't have the visual cues that you normally would when you're talking to somebody face to face. And for people, you know, with dementia, they really pick up on our nonverbal, and they're not getting that on the telephone. So something to keep in mind, and I know with COVID, what we've been doing a lot is we're trying to connect more because we can't physically go visit somebody, but picking up the phone, that might be helpful. But if you have access as well to, you know, FaceTime, and there's so many different platforms where you can actually see each other, that might be something that could be helpful to connect and sort of help with that problem with abstract thinking. All right, so misplacing things. So, you know, some of us can misplace maybe our car keys, maybe it's the remote control that we misplace, but we have a tendency to be able to figure out what we did, and we can kind of backtrack and find that item. For people with dementia, it's putting things in strange places or peculiar places. So we see this woman here and she's opened up her fridge, and we see that she's got a dress hanging on the inside of the fridge. So it could be, you know, a dress in the fridge, or it could be, you know, taking your wristwatch off or your rings and putting them in a sugar bowl, and then trying to figure out where that object is or where that item is. And because it's placed in a different, you know, an odd spot, it can be really difficult for your family member to find, and not uncommon then for them to become suspicious. You know, I can't find my wallet, I can't find my purse. And because you live with your partner or, you know, your adult parent, logically to them, you're the only person that they normally see. So they're automatically going to become suspicious of you and thinking that maybe you took that item. So one of the things, you know, when we support a person with dementia, really important to know that there are changes that are happening in their brain, which are causing, the ability for them to remember where they put things or to put things in odd places. They normally wouldn't be suspicious of you if they didn't have these changes that are occurring in their brain. So getting as much information about the disease and understanding how it impacts your family member, I think we have a tendency then not to take it so personally when you get the finger pointed at, saying, you took my wallet or you took my purse, that sort of thing. Always important, though, to try and address the fear. So if she's fearful that she may have lost her wallet or her purse, then say, I understand this is quite disconcerting, or I understand you're upset. How about if I help you look for it? Okay, so those are some of the strategies that we can help with our families. Changes in mood and behavior. So we see this gentleman here, and he seems, maybe he's a little bit confused, but he's experiencing a number of different changes. So it's exhibiting severe mood swings from being easygoing to quick in one moment, and then all of a sudden begin to cry. We may not necessarily know what the trigger is. Sometimes, however, the trigger could be a change in the environment, right? Or maybe they're in a situation where they're not necessarily comfortable. And with these changes that we've experienced with COVID, they may not be doing the activities that they used to do. So that in and of itself is a change in routine. So if you happen to see, a change in mood, there may be a trigger, there may not be a trigger. But sometimes the thing that can contribute to that is a change in routine, right? So trying to build a routine and a schedule as close as possible to their original routine prior to COVID would be something that we would suggest. Changes in personality. So I think we all know that our personalities can change a little bit in subtle ways over time. But for people with dementia, they may behave out of character. So they may become more confused. They may become suspicious or fearful. And so with these changes in personality, we may also see a person become more apathetic. And they may act out of character. So it may be something completely different than what we're used to, okay? Maybe Bob becomes a little bit more agitated, or maybe he doesn't have as much patience. We talk to families all the time and we say it's so important for you to have patience, but it's not uncommon, obviously, for people with dementia, for all of these changes that they're experiencing, they're going to lose patience as well. And I think that's human. We're all human, and I think it's to be expected. It's just trying to figure out how to support them in those moments and how to support yourself in that moment, which is key as well. And I hope maybe somebody will ask a question around self-care when we're looking at questions that might pop up in the chat. All right, so moving on to the final sign or symptom, loss of initiative. So we see the gentleman sitting in the couch, and we know that maybe he used to like to go for a walk with his partner, maybe he liked to play tennis, maybe he liked to golf. So loss of initiative, losing interest in friends, family, and favorite activities. So from time to time, maybe we get really busy and we lose the get up and go that we have. But we do know that there's a part of the brain for people with dementia that kind of regulates that get up and go. So really important for us as family members to be able to continue to hear. I know we can go for a walk. Maybe we can feed the ducks, or just see the squirrels, those sorts of things. Really important to be able to ensure that we can continue to engage our family members in activities that they like to do. Okay. And then one of the other reasons why a person may fall back, again, we mentioned it earlier around language, is they may become embarrassed because they can't find the right word. They can't figure out the right thoughts to put together. That may also affect their initiative and their desire or need. So it's just really important for us to continue to offer to do different things. And when you're offering different things, my suggestion would be to ensure that you don't offer up too much. The choices, make sure you give 1 or 2 choices. Would you like, Dad, would you like to go to the public gardens, or would you like to go for an ice cream? So those are the sorts of things that we would suggest. Okay, so loss of initiative would be the last of the signs and symptoms. And important, again, I'm going to reiterate this, not all of our family members will experience these symptoms, okay? It can be very gray. Some people may have memory loss, some people may have more of a personality change. So it's just to support them as best you can. And if you have questions, and if you're looking for tips and strategies, give us a call at the Alzheimer's Society through our info line, and we'll be able to help you with that. We hope that you have some questions for us through the chat. So I guess, Claire, I will hand it over to you now.
Hi.
Hello.
Little bit of a delay there, getting to my unmute button. Thank you so much, Cara. Lots of great information there in your presentation and lots to think about. So we do have some questions, and if anybody wants to send in a question, don't forget to type it in the chat box and press enter. So yeah, so we can make a start with these.
Sure.
So the first one is, what is the difference between normal memory loss that comes with aging and dementia?
Okay, and so memory, and again, this is a question that we get frequently in the community. People may be concerned about their memory, the age-related forgetfulness, and so I'm thinking how many of you may have gone from your living room to your kitchen, and you had a purpose as to going out to the kitchen. You can't remember exactly what that was, and so you may have decided to do something on the way from the kitchen to the living room to the kitchen. You get distracted and you forget what it was, and then you realize it was the remote control for the television. So sometimes we have age-related forgetfulness. Usually though, what happens is there's something that will cue us and get us back to remembering what it was that we forgot. What's different about memory loss associated with dementia is it affects a person's day-to-day. So, you know, looking back on the infographic or in the slides, we've seen the gentleman who was preparing his meal. And so it was really difficult for him to remember that I had to deshell the eggs, you know, to cook the eggs, that sort of thing. And it's the recent memory that people begin to have a difficult time with. People with dementia, they have difficulty in getting the information to stick and then pulling it back out again.
That's right. I think as well with the direction and going a familiar route every day, and then finding one day you get to the place you're going to and you can't remember how to get back home. It's more significant than the general forgetfulness we all have.
Yeah, definitely.
Okay, so another question we have, and it's kind of 2 parts. It is a person that's worried about their partner's memory and how to get them a diagnosis, especially when they don't know they're having symptoms or don't recognize that they're that concern about their symptoms and forgetfulness.
Right, and that can be difficult. That can be you're playing a balancing game there, because you really want to respect your family members' autonomy. You want to be able to respect that if they're not recognizing the changes, how do I go about bringing up these changes? If it's my mom, for instance, and if I'm worried about my mom's memory, will she be offended by me, you know, saying, Mom, I'm a little concerned about your memory. So I think, frankly, the one of the suggestions that I would have is to sit down and talk to them and ask them if they've noticed changes in their memory. And if they have, would they like to do something about it? Because we know that, in getting an early diagnosis, the benefits of getting an early diagnosis is it's understanding, oh, this is the reason why I'm not being able to do what I used to be able to do, or I'm having difficulty in forgetting how to get from A to B. I think there's some comfort in knowing that there's a reason why these things are happening. And so also, you get to explore medications, right? You get to explore resources that are available. I would also want to make sure that I got enough information about the disease and how it's going to impact me, but I want to be able to plan for the future. So looking at things like, who would I like to designate to make decisions for me when it becomes time that I have difficulty? So those are some of the reasons why myself, if I see changes in my memory, why I would like to go to get a diagnosis. But again, I think maybe it's sitting down with your family member, expressing what your concerns are, and then going from there. But ultimately, really important to talk to the family doctor, because perhaps it isn't dementia. It could be something, the memory loss could be associated with poor diet. It could be related to a condition that they have had in the past. So there's so many reasons why it's important to sort of investigate exactly what's going on.
Yes, I've heard that too, about it can be a side effect of a medication, and it can be something quite simple, and so it is a benefit to go and get checked out.
Yeah.
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 So there is another question, and this is a person who's concerned that they do have symptoms themselves, and they're asking at what point should they take themselves to the doctor for a possible diagnosis. And I guess this links in with what we've just said, which is that earlier
the earlier the better. Yeah. And just
never too early to go and
just the thought that they're thinking about it, the thought that they've noticed some changes and that they're concerned. That concern to myself, or that concern would be a flag for me to go maybe talk to the family doctor. And if they are going to go to the family doctor, my suggestion would be to be concrete about the details and what are some of the concerns that I have. I've noticed a change in my personality. I've noticed that I'm shorter with my family members. I've noticed that I can't find the right word. And I noticed that sometimes I just, I learned something new and I just can't keep it where it needs to be. So yeah, the fact that they're thinking about it and that there is a concern, that would be a flag. But again, it might not be dementia. It could be something else, something that's treatable. So yeah, I would say go ahead and write those things down and then go to your family doctor and have an assessment and discuss your concerns with them.
Okay, getting some great questions here. So the next question is, a person that lives with early stage dementia is asking, do you have any tips to help me to remember information? And I guess some memories, tips to help with memory, but it's, remembering information.
Yeah, memories. So I know some people have become, they've become quite creative in the different things that they do. So for some people, they will use their cell phone to take notes. But I have one client who has early stage Alzheimer's disease, and what she found really helpful was taking a notebook with her wherever she went. So especially if she went to the doctor's office, what she would do, she knew that she wasn't going to be able to remember if there was a change in her medication or if there was a change in the time that she needed to take that medication. So what she did was she gave the notebook to the family physician, gave it to her, and asked her to very simply write down instructions for her to follow once she returned home. And the other thing that some people have done is, they've used sticky notes and they've placed them at eye level so that they could remember. So if it was leaving to go to the library, they would take the sticky note and put it on the outside, like on the exit, the doorway. So if they lived in an apartment, they put that right beside the door, and they would write down, remember to take your keys, remember to take your library card, remember to take your wallet. And so they'd have these little sticky notes in areas where they could visually see them. So that's what some people have done. And then others find it difficult in remembering who it is that they're speaking to on the telephone. So what they've done is they've made a habit of writing down the friend's name when they're talking on the phone so that they don't forget about who that person is that they're talking to on the phone. So people have come up with some really creative ways to keep those memories, or to keep that information at close at hand. The other thing too, of course, is calendars. But again, as I said earlier, if a calendar is going to be a trigger, then don't use it. If it's going to if it's going to create anxiety, then I would put it away. But for a lot of people, having that visual reminder is a good cue, especially when you've got appointments that are coming up, or if there's birthdays or anniversaries that you're trying to remember.
I was thinking of alarms on phones as well. Reminders can be quite helpful, and the notebook by the door, by the phone. Just all these things that can trigger that.
And
what we need to remember.
With medications, there's the blister packs, which can be helpful as well. And then sometimes some blister packs can be hard to get into, though. But yeah, so there are a variety of different tips and strategies that people can use.
Okay, so we'll just move on to the next one. And so my family member is having a difficult time trying to find a word, and I know that can be really get a bit frustrating. So what could I do to support them?
Sorry, I just got a chat question there.
Oh.
I was reading the chat question. Sorry about that, Claire.
That's okay.
That? I wanted to make sure I had the question come through.
A question about word finding. So when your family member is unable to find the word that they want to say, maybe you know what the word is, but what is the best way to support the family member?
I think if you know your family member best, and if they're looking to you to help you to find the word, then by all means, I would enter in to that space with them and say, hey, is this the word that you're looking for, Mom, or Sue, or whoever it is? But if you feel that they're getting frustrated, then maybe what you could do is, some people will use humor, which might work. Other people may sort of step away and say, it's okay, you know what, we can come back to that at another time. Because I think sometimes the more pressure we put on a person too, the likelihood that they're able to sort of perform and find that word becomes more difficult. So if they feel that we're waiting for them, it depends upon the individual. Some people may be looking for that word, and others may appreciate if you maybe go on to something different. All right.
Thanks, Cara. So another question is about personality changes. So the person with dementia becomes depressed or maybe less patient than before. Mm-hmm. And the person for whom is caring for them is maybe, sorry, I'm going to have to reword that. So this person often hears about personality changes where the person with dementia can become depressed or less patient, but their person is having the opposite symptom. They're kind of becoming much more relaxed and carefree. And is that something they should be worried about? Is that okay? Is that a common thing to happen?
It's so interesting because, yeah, sometimes we do hear that. We do hear that maybe somebody who used to be quite anxious, all of a sudden they're more relaxed and they're more calm. So, that not everybody is going to, not everybody with dementia will become apathetic or display symptoms of depression or agitation. I think sometimes we have a tendency to hear of these things, and it could be, through media that we hear these things, but everybody's going to be a little bit different. And honestly, if your family member is calm and they are relaxed, then I think that's a good thing. I don't think it's anything that I'd be concerned about. Yeah. I think the types of change in behavior that we become concerned about are those behaviors which change fairly rapidly. I mean, actually not fairly rapidly, but rapidly within a 24-hour period, where it's almost as if I don't recognize this person anymore because they've changed so much. Then we begin to think, okay, there's something else that's happening here other than dementia. They may have an infection. So then, if that's the case, then I would definitely say call your doctor and explain, or call 811, explain what the changes are, and make sure that when you're talking to the person, the nurse on through 811, make sure they have an understanding that your dad or your partner has dementia, so that they can assess properly, knowing that, okay, there may be some changes, but this is a new and rapid change. This is something significant. And then you can kind of explore from there.
Okay, there's another question connected to personalities and behaviours that can happen. So in the early evening, the symptoms that are happening are extreme tiredness and perfectionism. Mm-hmm. So is that, again, something individual? Is that quite common?
So sometimes we hear of, in the evening, in the early evening, people with dementia, some people may get restless. And it's because they may be tired. Their brain is tired. It's working harder. For people with dementia, their brains do work harder because they're focused. It takes longer to concentrate and focus. So come 5 o'clock in the evening, and there's a change, there's a change with lighting as well, which can contribute. The environment changes. There could be people coming in and out of the house, doors opening, closing, which may be contributing to that. And that may be, and I think I would need a little bit more clarification around what you had said about perfectionism. So I'm not certain if they could clarify a little bit more about what they mean around perfectionism. Is it restlessness? Is it that they constantly need to be doing something at that point in time? Is it going through drawers or opening drawers, or I think I probably need a little bit more clarification around that. But if they could call us, then we could get a little bit more details and sort of strategize around that for them. I have had clients in the past who may have had in their professional life, they may have been, say, an accountant or a pharmacist. And so they've been very detailed with the things that they do. And there's a sort of repetitiveness in their the new activity that they've taken up, sort of mimicking some of the things that they would have done in their job. So that's why I'd say with that perfectionism, it would probably be good for them to give us a call. We might be able to strategize around that a little bit, just to explore more exact what time of the day does it happen. It's 5 o'clock. Also, is it because that person is bored? Have they not done enough during the day as far as, activities that give them purpose, or things that they're interested in? So that could be another reason why we start to see that behavior change in and around 5 o'clock in the evening. So what I would recommend then is trying to find something to distract that behavior, to change up that behavior. So is there something, it's like maybe some calming music, maybe it's doing a quiet activity together in a quiet area of the house. Those are some of the things that I might suggest to try to change that behavior.
I was just going to say, you mentioned InfoLine, and I was wondering if you could just speak to how you help people who do call in. And obviously people do call in with these questions, and you help them troubleshoot and point them in the direction of the information they need. So.
Yeah. And so through our InfoLine, InfoLine is a provincial service that we offer. So we provide information, education, supportive counseling We meet people where they are as well. And I think that's one of the things that people sometimes are fearful about picking up the phone because they don't know what to expect. And so we ask a few questions to figure out, is this something new for them? If that's the case, then we really want to meet them where they are and provide them with little bits of information. But we can get them connected to the services that they need at the time. We don't want to give them too much information to overwhelm them. So they may call us and they may be looking for, okay, how do I get a diagnosis? How do I go about preparing for that diagnosis? It could be, I noticed that my family member is getting up at 2 o'clock in the morning. What can I do? Why is that happening? So it's coming up with some tips and strategies around behavior. It could be linking them with a caregiver support group. It could be letting them know that there's an event that's coming up that's related to maybe education in the community. Or we might be able to refer them to other partner organizations and their programs as well. So it's an intentional, confidential follow-up. So when they call us, the information it's important for them to know that it's confidential. So if another family member were to call and look for information, we can't share information without their permission. And it's not uncommon for us actually to be providing service to families for several years. Sometimes they come to us in the beginning just after diagnosis, or they go through the process and ask us, how do we go about getting that diagnosis? And so we really journey with them and develop a relationship with them through the progression of the disease.
Thank you, Cara. So, and I understand that you have the same person contacts the client, so you do build that relationship, and you support families and persons with dementia and professionals and people who may have friends who have dementia and they have questions. So
exactly.
You're a wealth of information on the info line.
Yeah, and for the info line number, I just flipped it over to our final slide there. So I've got the 1-800 number there, which is the provincial, and also our website. So I would highly, encourage people to go to our website. There are a number of different fact sheets through our day-to-day series, communication, caregiving, research, our virtual Fridays, archive sessions as well, which we've done over the past several weeks now.
Okay, so we are at the end of our time today. So thank you, Cara, and thank you to everybody for tuning in.